Back in 2008, just 1 in 20 hospitals used electronic health records. A decade later, we've made enough progress to flip that number entirely. Today, just 1 in 20 hospitals have not adopted electronic health records. And over the past decade, we've seen how better information about a patient's health care does make a big difference. In national news, electronic health records played an important role in understanding how the water in Flint, Michigan was putting families in danger. And while they don't always make headlines, electronic health records also make a difference by helping care providers identify health problems sooner so patients can get preventive care to stay healthy, avoid duplicative tests or medication errors, and identify treatments that might be counterproductive based on a patient's medical history or current prescriptions. The HITECH Act we passed in 2009 was a big part of accomplishing the progress we have seen so far, but we have to continue building on that progress to ensure health information technology lives up to its full potential. And we have to continue oversight following up the work we did in 2015 after the Office of the National Coordinator for Health Information Technology put out a report detailing some of the challenges ahead. The report made clear information blocking was a serious problem throughout the healthcare system. While HITECH required certified electronic health record products to meet technical standards intended to make good information more accessible for care providers, the ONC report found substantial evidence some organizations were intentionally setting up barriers between their systems and other systems, like exorbitant fees whenever someone sent, received, or even searched for a patient's information, contracts that restricted people's ability to access and share their own health information, and systems built in ways that made sharing information needlessly complicated. Maybe they missed the day in kindergarten about sharing, because putting something where only you can reach or charging excessive fees for it is absolutely not how it should be done. And it is absolutely not acceptable when it comes to people's health. We cannot afford to have bad actors who prioritize their bottom line over patients' best interests and block information hospitals, providers, and patients need to be able to share that with one another. We also cannot expect health IT systems to get better when some vendors include gag clauses that prevent care providers from speaking out about the problems or issues or errors they encounter. It should be easy for providers shopping for electronic record systems to learn about potential issues. It should be easy for medical professionals to hear about a problem with a system they use, and it should be easy for anyone to speak out when they see something that would jeopardize people's health. When systems cannot speak with each other and people cannot speak up about the problems they see, it is patients who do get hurt. Like the man in California who suffered brain damage after his diagnosis was delayed because a hospital's software could not properly interface with a lab software. Or the woman in Vermont who died of a brain aneurysm that might have been caught if a software problem had not stopped the order for a test that she needed. When we talk about making sure we have a strong health IT system, we're not just talking about technology and innovation. Families' lives depend on making sure we get this right, which is why I was glad we were able to take steps to address these issues in the 21st Century Cures Act. I look forward to hearing from our witnesses about their perspective on ONC's proposed rule to implement the Cures provisions. In that bill, we moved to end information blocking and make clear when patients and their care providers need information, they should not be stopped by unnecessary, unreasonable barriers. And we tasked ONC with clarifying what sort of concerns, like privacy and safety and security, would be grounds for reasonable exceptions. We also took steps to help ONC strengthen its certification program beyond technical criteria for electronic health records so they can make sure that if vendors want to get the government seal of approval, then they cannot engage in information blocking or use gag clauses. The new conditions also called for open application programming interfaces, or APIs, another step that will help make sure systems developed by different vendors and used by different doctors are able to speak to each other, and that patients have an easier time getting access to their medical records. I'm glad ONC is moving to put these common sense steps in action. I'm interested in making sure this gets done right. I look forward to hearing from our witnesses about their perspective on ONC's approach and about the steps the Centers for Medicare and Medicaid Services is taking to make claims data more accessible and prompt care providers to be better about sharing information. Of course, as we continue to improve our health IT system, we need to make sure that health information is being provided in a way that works for patients as well. During our 2015 hearings, I shared the story of a woman who had been seeking the results of her pregnancy test, but instead of a clear answer, her electronic health record simply reported her hormone levels. Not helpful. We need to do better for her and for other patients who've gone looking for information they can use only to find massive binders, unreadable PDFs, and stacks of CDs. Engagement and usability have to be part of this discussion. And last, certainly not least, we need to talk about security, privacy, and data stewardship. That means prioritizing the development of technology and best practices that can help prepare for the constantly evolving cybersecurity threats of the 21st century. It also means having a national conversation about what is required for all parties to be good stewards of the data people entrust them with. And that conversation is only going to become more important as tech companies and others introduce new products like mobile applications that empower people with their healthcare data but are not covered by existing HIPAA protections. Patients should be able to expect tech companies are going to use their most sensitive information responsibly and give them the tools they need to be able to control how and when their information is disclosed. Our objective should be to make sure tech companies are putting patients in the driver's seat, not the other way around. It's clear we have come a long way when it comes to strengthening our nation's health information infrastructure, but it is also clear there are a lot of challenges ahead. So I look forward today to hearing from all of our witnesses. Thank you for being here. We want to hear about how data and technology can actually empower patients and care providers, and I hope we can continue our bipartisan work on this important issue, Mr. Chairman. Thank you.